Okay, so you are welcome back, everybody. So this is day 2. Okay, so yesterday we spent a lot of hours talking about first aid. We started with the definitions, and we also looked at some of the important concepts, what you need to do this very well. Okay, I hope you still remember the definition of first aid. Okay, first aid is basic care or emergency care. So giving to who? Ill or injured person. So when somebody is ill or somebody is injured as a result of emergency, remember that emergency is something that can happen unplanned. You don't plan emergency. It can just happen. And of course, emergency has some bitter taste and can also go from bad to worse if you don't do anything. So usually one of the things we are expected to do is to help the person. And of course it's voluntary. Okay, that's the reason why you need to seek consent. Okay, you have to introduce yourself. My name is this. I am trained in first aid. Can I help you? And remember, we have 2 types of consents. Yes. Yeah? Voluntary and implied. So voluntary, you expect voluntary from an adult, somebody who can make decisions independently, who is the right frame of mind, okay, and who is accountable. You can hold the person accountable for the decision the person has made. Okay, so you have to give me voluntary consent. I don't have to force you. I don't have to persuade you. But I am willing to help you. So all I need is your consent. So implied consent is used in a situation where somebody cannot give consent because the person is unconscious. So another case is a baby. Okay, if a baby is in need and no family member is around that baby, so you can use implied consent in that case because baby cannot say yes or no. Okay, and yesterday remember that we also talked about the steps you have to follow when you do first aid, and that was covered under emergency scene management. And emergency scene management was yesterday you were made to know that is the foundation of this course. So emergency scene management is the foundation. So the training is like a building, a house. And that house must have a formidable foundation. And foundation is that emergency scene management. Remember that emergency scene management is series of activities you do when you perform first aid. Series. And the objective is to lessen the impact of that emergency. So anything you do within the scope of first aid, and your objective is to lessen the impact of the emergency on the patient, that belongs to emergency scene management. So it's a process. So I personally consider first aid a process. So you can divide process into different sessions. step by step. So first aid is a step-by-step way of lessening the impact of emergency on the patient. So you have step one. Remember yesterday we saw different steps. There are 4 of them, okay, like that. So you climb. So it's like a ladder. You start from step 1, you keep on moving until you get to step number 4. So you have step 1 here, step 1, and step 2. Then you have step 3, and then you have step 4. So this is how I can describe emergency scene management. Okay, so here is scene survey. Yeah, scene survey. So this is the starting point. Scene survey, primary survey. Okay, primary survey. Secondary survey. Yes, secondary survey. And ongoing patient care. Ongoing patient care. So those are the trajectory. First aid trajectory. So you start from here and then you aim towards step 4. You may not reach here. It depends on, let's assume it's a major emergency. And then you have called 911. And they have told you that they are coming. And then you expected to start providing first aid as you keep on moving up. So they may meet you somewhere along this road. Okay, and then when they meet you somewhere, you are expected to give them a handover note. So that, yes, handover note is where you tell them what you have done, or in fact what happened, the situation, briefly tell them, summarize what you have been dealing with, what have you done, and then they take it from there and then do the rest. Okay, but where it takes them some time to come, you may actually make it up to this level. Okay, so remember that scene survey is where you scan the area for your safety. Remember that is also where you take your protection into account. Yesterday we talked about how to do that. The most basic one, hand washing, the gloves. Remember the gloves?
Yeah.
We did, yes, gloves and all that. So you need that. So at this level, you think about your safety. You think about protecting yourself. And you also think about obtaining consent. Those are the 3 key things. In addition to you trying to know how many people are affected, you also want to know what may have caused that. You also want to know if there are people around. You can yell for help to draw their attention. So that is where so it's like the beginning of the journey. So this is where the first aid journey begins. So you, in doing that, you want to make sure that safety is guaranteed. You're not going to be a second victim, because if you don't consider this, if you skip this, you may become another victim. Remember, there are hazards everywhere.
Yes.
Hazard is anything that can cause harm or death, and they are everywhere. Even in this class now, look around, there may be hazards, so you have to be very, very careful even when you are walking. The floor could be slippery. Okay? We can have wet floor. There are many things when you walk on the road. The moving vehicles, they are all hazards. The snow on the ground is the hazards. The hazard when you are cooking, the kitchen knife you use, the boiling water. So hazards everywhere. So that's the reason why you have to take that very, very seriously. And of course, primary survey. So once this is clear, okay, everything is good here, you now progress to primary survey. Remember that primary survey is the heart. That is the heart of first aid. It's like the compass of first aid. It takes you the direction that your first aid should be heading to. So it's you know the work on GPS. So this is like GPS. You put the address, and then GPS will be able to navigate you. So this is where you get an idea of the direction you may be heading. By quickly, so it's rapid assessment of the patient. Rapid, quick assessment. So you don't waste too much time here. You quickly assess. And remember that when you do that assessment, there is one thing at the back of your mind, whether your patient is facing any life-threatening condition. So primary survey is a quick assessment of the patient. Okay, quick assessment of the patient to determine if the patient is in any life-threatening condition. And in doing that, you need to assess four important elements, four important variables. Remember yesterday we used R, A, B, C. R, A, B, C. R, A, B, C. R is responsiveness. Right?
Yeah.
Remember responsiveness,
Airway.
Breathing, and what? Circulation. So those are the four important elements, area you must assess, and that is quickening. So the outcome on this assessment will determine if what you are dealing with here is life-threatening or not. Remember we said yesterday that any emergency that affects any of these, an emergency that affects any of these is considered what?
Life-threatening condition.
Yes. So, so responsiveness, hey, are you okay? Can you hear me? You tap the shoulder. So you see whether the person is able to respond to the stimuli of voice and touch. Those two stimuli should be enough to assess that. You see whether the person moves or whether the person reacts in any way to those. Airway. Remember that the airway connects the nostrils to the lungs. So that is the passage through which breathing happens. So anything that comes, if the emergency touches the airway, that has placed the person in life-threatening situation. Because that is the only route through which breathing happens. You take oxygen through that route, the airway, okay? And then breathing, you also check the person's breathing. Is it normal? So if you were to count the breathing, how many times is this person breathing in 1 minute? And for an adult, we say between 12 and 20. Okay? Not only that, you also want to consider the quality of the breathing. Okay? What's the quality? Is it effortless? Is it noisy? The person laboring to breathe. Laboring. to breathe. So all those things you take into consideration. Okay, and then you come to circulation. So circulation, you are looking at the skin, the person's skin. So circulation, you are looking at the skin, the person's skin. Okay, skin color, skin condition. Okay, so you're also looking at temperature, and then you're looking at the bleeding, blood. Okay, so skin is very important. Skin condition, color, so very important. Temperature, skin temperature is also a very good index here. Skin temperature, so touch the forehead with the back of your hand, and then that will tell you. And then see, is the person bleeding? Okay, so this is if the emergency has touched any of these that is life-threatening, you have to call 911 in that case, and you have to follow up right away. You must do something because the person's life is threatened. That's the meaning. In other words, if I fold my hand and then wait for EMS to come and I'm not doing anything, before they come, this person may go. If there was a case, somebody shared, it happened in a restaurant where somebody was choking, severe choking. And the people called 911, and for whatever reason, they didn't do anything. Maybe nobody was around, nobody knew what to do, but they did. They called 911 quite all right. So, but before the paramedics could arrive, the person passed. Yes, so that's it. So first aid, again, first aid is very important. So that space, when you call, and then when they arrive, I'm talking about paramedics, it takes some time. So that is actually the space that the first aid should occupy. You're supposed to be doing something. So that situation is not going to escalate. It's not going to go worse. Because if you fold your hand and somebody is bleeding, or somebody is having a heart attack, all those signs and symptoms, or somebody is showing the signs and symptoms of stroke. Remember signs and symptoms of stroke, FAS, face drooping, arm weakness, speech difficulty. Okay? Remember you're supposed to add the T fast. Okay? And if you don't add the T, when FAS is present, and you didn't add the T, which is your part, this person's condition will grow worse. So when somebody's life is threatened, you must do something. For instance, somebody is bleeding, okay? You need first aid kit. You need to put your gloves. You need dressing and bandage. You need direct pressure depending on the nature of the injury or what is causing it. So you need to put pressure on it. You need to stop that bleeding. So you are not supposed to leave this terrain. You won't leave it until the situation is under control. So that is only when you can move to secondary survey. So when you are here, it means that this situation under primary survey is under control. You get what I mean? I hope it's clear, right? Yeah, yesterday we spent a lot of time on this. I'm just trying to, rehearse it because that is foundation. Okay? How well you are going to do as a first aid that depends on your understanding here. Okay, very, very important. So secondary survey is where you focus on non-life-threatening injuries. Non-life-threatening what? Injuries. Over there you do basically three main things. You take medical history. Remember sample. Okay? Remember, who can remember S means what? Have you forgotten?
S.
Yes, in sample. Remember sample. When you do medical history of the patient, simple medical history.
That is vital signs.
Signs and symptoms.
Yeah.
Yes, signs and symptoms. A is allergy. When you ask, are you allergic?
Yeah.
M is medication. Are you on medication? P is past experience. Have you had this experience before? Similar experience. L is last meal. When did you eat? Have you been eating? What did you eat? Stuff like that. And then E is what? Event. The mechanism. What happened? What led you to where you are at the moment? So that is sample. And then the next thing you do is, so here you do medical history. So sample should be able to do that for you. You do vital signs. Okay, vital signs. You take the vital signs of the patient. Vital signs. Remember that there were 4 of them that we covered. Okay, heart rate. Heart rate, which is the same as pulse. Okay, we also do respiration rate, breathing rate. Okay, and then you take temperature of the patient. You don't need any equipment here. You need it back of your hand.
That's feel.
Yes, yeah, feel. Is it okay if I do that? Yes. Okay, and then level of what? Level of consciousness between 0 and 10. What number do we give this person depending on the level of consciousness? So I don't intend to go through this again. We covered this. Unless you have any question, then I can maybe pause and look at that again. So, but this the vital signs is supposed to. Usually you do the heart rate. Okay, when you're doing the pulse, you do it for 15 seconds. Okay, and then whatever result you get, you multiply by 4 to make it 1 minute. So another thing you do here is what we call head-to-toe assessment. So if you go to chapter 11 of your book, you see that chapter is dedicated to this topic, the secondary survey. So head-to-toe assessment. So while you are waiting for the paramedics, so you can assess this person from head to toe. Remember, there are 2 types. Okay, the person is unconscious, you do hands-on. But if the person is conscious, you do what? Hands-off. So you just give commands that walk you through the head to the toe. See how well your patient is following those commands. So those are part of things you do during secondary study. And then ongoing patient care. Ongoing patient care. This is where you have done all you need to do, but you don't abandon your patient as long as EMS has not arrived. You are expected to stay with the patient. Reassure the patient. Okay, update the patient. Monitor the patient. So keep on reassuring, keep on monitoring. A, B, C, airway, breathing, and circulation. Periodically, always look at those 3, A, B, C, make sure that nothing has changed. Okay? So that's what you do. Keep on, if you need to support the patient manually. Okay, remember yesterday we talked about SMR, spinal motion restriction. Remember when I told you if somebody has a head injury, remember that you need to do this is called manual support. Okay, so if you need to do this while you are waiting for EMS, keep on doing it. Yeah, don't leave it. Don't leave the patient, and then the head is turning like that. That may cause more damage. So you keep on, okay? So that's emergency scene management. That is the summary of that, and this is very important. Remember that every first aid you provide, you have to go through this. and is not dependent on the age, whether it is a baby, whether it is a child, whether it is adult, you follow the same recipe, the same template. This is just like standard algorithm, step-by-step way of doing first aid. So it doesn't matter on location, whether it is at home, make sure that you don't skip scene survey. Whether it is on the road, make sure you don't skip this. Make sure if it is in the office, you still expected to go through these steps. Yes. Okay, now does anybody have any question? Okay, yes, ask your question, please.
So under the vital signs,
Yes.
the heart rate, I suppose you said we have to give it the same, that is what you get divided, is it divided or?
No, you multiply by 4. Normal rate means over 1 minute.
Yeah.
Okay, that's meaning of rate. So, but in emergency, you can do it for 15 seconds. 15 seconds, okay? And then let's assume you get 20 in 15 seconds. Then multiply it by 4. 4 times 15 is 60.
Okay.
That's this will tell you 80. That means in 1 minute, the person's heart is beating 80 times.
Okay.
So that's how to. If you have time, you can do it for the entire 1 minute. But in emergency, time is very costly. So you do it for 15 seconds, and then whatever answer you get, multiply by 4. That will give you 1 minute. So that's what I said. I hope that is clear.